Hello, this is Siska Natalia and welcome to Palliative Care Nursing about Palliative Care Nursing Care Plan. These are the objectives of this topic today: to understand and demonstrate nursing care plan in palliative care and describe common nursing diagnoses that used in palliative care nursing in all aspects of life, and then describe nursing interventions related to the patient's illness. In nursing care plan, as we know, there are 5 components that we use. The first one is assessment. Please use assessment tools that teach in school or university or workplace. For example, Siloam end-of-life assessment tools, and then Liverpool Care Pathways. And then the second one is nursing problems. Please remember to include symptom management to bereavement process. And then the goals is quality of life of patient and family. And then intervention, and last is evaluations. These are primary aspects from the research from Hagen et al. In 2018. The first one is symptom management. Remember to do person-centered care and holistic approach to patient and then to family. And the second one is communication. The third one is advocacy. And then remember, the goals is to manage patient symptoms and improve quality of life. The first aspect is communication. We, as a nurse, are trained in communication skills. In palliative care, specifically for discuss prognosis, and then advanced care planning options, what options that the patient and family could have. And then the third one is medical decision. We can guide the or explain to patient and family what medical decision that they need, or to let them know what the decision that they have to make with medical decision. Please see Spike's protocol for in specific in breaking the bad news. The second aspect is symptom management. Please do remember that palliative care is not only for end-of-life care or end-of-life patient, or not stopping the treatment, but palliative care is emphasize the management of illness and do the treatment-related symptoms. Please take a look from palliative care concept about total pain that includes physical, psychological, social, and spiritual. You can see here the specific things in total pain. The third aspect is advocacy. Nurses is able to develop positive relationship with patient, engage in expert practice, and sets up the possibility of patient advocacy. And then nurses can collaborate within the interdisciplinary team, especially in palliative care team, to share patients' perspective and priorities. And then nurses are able to advocate patients and caregivers' concerns, worries, and priorities while making treatment decision. Why? Because nurses is with the patient for 24 hours and 7 days a week. Based on the research by Bensar et al. In 2011, please do think about the patient's perspective. The patient needs to know about information about prognosis and disease progression, but we should think about how much family already know and how much they want to know. We as a nurse often want to tell all things, or maybe like keep secret all things, but we have to ensure the patient and family how much they want to know. And then we have to prepare the patient and family to manage symptoms while they're at home or while they are in hospital, we can provide them with guidebook if it is provided by the hospital or the care facilities. And then as family, we should tell them, like, they have to know whom to call while when the patient in the critical moment. And then caregiver is also have their burdens. We have to, or we need to provide support group for care provider. For the first component is assessment. Please do refer to palliative care assessment that includes SSR and also the concept of total pain. These are the common nursing diagnoses from the research by Pereira et al. In 2017. But please do remember, your nursing diagnosis or your patient diagnosis is based on their response and needs. And please do take a look in subjective and objective data that supports your diagnosis in the patient. For nursing interventions, please take a look your nursing problems and do the nursing interventions based on their needs. These are for patients that approach end of life. Nursing interventions include the following. You can read in this PowerPoint. And last but not least is evaluation and discharge planning. We need to evaluate the effectiveness of our interventions that given to the patients based on the outcome criteria established for each patient. And the nurse should closely monitor for escalating signs of patient discomfort that is not managed by the current treatment plan. So we have to be specific and critical to the patient's response. And then discharge planning. Discharge planning is the administrative process of discharging the patient alive or dead. So when to do in palliative care or in other areas in nursing. So discharge planning is due when the patient came to the hospital or hospitalized or being cared, and who will do the discharge planning is the team, or in here is palliative care nursing. And how to do, we have to discuss with the team and the family to do the discharge planning, or what the patients and family really need when they can be cared at home. And in discharge planning in palliative care includes prepare for a good death. Please do think and reflect about what is a good death for you. And then bereavement support. So if the patient is died, so we need to refer to the counselor or spiritual leaders if needed for the family caregivers. For the example of nursing care plan applications, please see the PDF document from OpenRN with title Applying the Nursing Process at End of Life. These are the references that used for this topic. Please do write your concern or questions if you have something to ask or needed further explanations. Thank you.